Hello and welcome to another edition of Autism BC Talks. I am Brock. I'm our program manager here with Autism BC. Today, I'm very lucky to be joined by Stacy and Sarah from Bayshore Home Health. This month, our monthly theme has been about autism money matters, and we've been sharing a lot of resources and a lot of links to be able to help families apply for different benefits. And we were thinking, what are the services for all of the aging autistic population across British Columbia? If we think about provincial numbers, there are approximately less than 20,000 children who are on the spectrum in BC. And if we think about that, there are a lot of other people. If we estimate based on provincial averages, we would have at least 60,000 people that are on the spectrum living in BC. So we wanted to support what's out there and what are some companies that are allies to the autism community. So we welcome Bayshore Home Health to talk to us about a few different services they offer. If you have any questions, please type them into the chat and I can relay them. Welcome, Stacey and Sarah.
Thank you. Really appreciate it. And really, thank you for having us here today to do this presentation. We're really excited about the opportunity to talk to everyone. So as Brock mentioned, we are from Bayshore Home Health. Sarah and I are both area directors in different regions. And we thought this would be a great conversation to have. It kind of came about when we were talking about that intersectionality of individuals who are aging, as that conversation is not a common one, we find. A lot of the studies and focus have primarily been around children and supporting children. And so we thought, what a great opportunity it would be to talk about alternative supports that are available. So for myself, I'm the area director for North Vancouver, and my personal connection to the communities, I have a couple of really great friends who self-identify as being autistic. And those individuals have grown up with me. I absolutely adore them. And I've spent a number of years working with individuals.
Hi, I'm Sarah. I'm excited about this talk too. I really appreciate Autism BC for joining along with us to be able to speak to people who might be able to be supported in our communities. I come from this from the angle of a mom with kids on the autism spectrum, and I would just give a little heads up that I'm a little bit new to the autism language, so I ask for some grace if I say something that is not your favorite. I mean no harm, but my kids are aged 20, 18, and 12, and they were all diagnosed in the last 4 years. So fairly new to this, but I have been living with an interesting household for a while.
Well, thank you so much for joining us, and thank you for being open to learning and listening from the autism community. I think that's very important.
Thank you. So we thought that this would be a great opportunity to kind of start and talk about some things that we've seen. So we have noticed that aging adults with autism spectrum disorder are at a higher risk of co-occurring conditions. And for some reason, there is a misdiagnosis for many children, and that can have an unintended consequence as individuals age. Sometimes directly correlated to housing options and how that impacts individuals as they age. And so we thought, why not jump into different services that we provide and looking at housing options from alternative perspectives, because a lot of individuals and a lot of families aren't necessarily looking at all the options available to them. They might see government funding or they might see public funding, but not necessarily seeing ways to be creative with housing supports, which can offer the ability of individuals staying in a place that they're comfortable with, or even offering independence in ways that you didn't previously imagine. So one thing that we wanted to bring up is there's a lot of themes in care. A really great quote that we like is a lot of the reason why we end up having more health problems is because in adulthood, we don't get the support we need to manage our health care. So we've noticed some trends from our side. There's the piece that we noticed that there's a lot of experience of loss of pivotal caregivers. So what we mean by that is support networks have changed. They're not necessarily consistent with adults. This can lead to missed medical appointments, missed medications, or even under-accessed medical resources, so insurance supports. And there's a variety of reasons that can be attributed to that. So sometimes fear of discrimination for accessing these supports. Potentially it was a negative experience in accessing supports. And sometimes it's not even, it's a lack of awareness of what is available out there in terms of supporting options. I know we both have anecdotes that pertain to this. I think Sarah had a really good one when we were chatting previously.
Yeah, one of the people that I know in my extended family needs to wear a medical alert bracelet, but just couldn't get the right size, and then it broke, and this is kind of an emergent thing that somebody needs to be wearing, but without the supports, even just to take the steps to kind of problem solve to get it on, that was kind of a trend that I was seeing, in terms of knowing how to do something that some people would say is 3 or 4 steps, and we know like accessing funding and finding housing is multiple steps. So it's nice to have kind of a group of people that can walk together.
Yeah, so we kind of see this as when you're living independently, there's a lot of things that you become responsible for, so including attending medical appointments. So in order to live independently, you do need to have health that is supported in that independent living. And so when we talk about individuals accessing supports, sometimes medical appointments can be overwhelming, and that's because it's information overload. It's not knowing who to contact. It's not knowing where to go. And so how do we help provide resources that would allow someone to maintain an independent lifestyle or be able to be at home where it's most comfortable for them? So there is support and there's different options available. So one thing that Bayshore does do is we do have caregivers that we provide that can actually help with some of these items, such as attending medical appointments or even medication reminders, or helping create even routines or any kind of help. So this, in some ways, can help you stay at home, or help families stay at home, or help present alternative options to potentially what we call home share in BC. So living with other families, or potentially living or attending a facility. So instead of just looking at it from the perspective of when you age, you need to go to a facility or you need to live with another family, there's a possibility maybe of remaining in home. And the way that you can remain in home is to make sure that there are supports in place. So we try to look at it from the perspective of what can we do to provide an alternative discourse for individuals so they can maintain independence. I was gonna say, did you want to add anything there, Sarah? You looked like you did for a second.
I just want to say that what we're trying to do at Bayshore is to increase our training and education of our staff, so that when we do have them work with individuals on the spectrum, that they have some level of understanding and they're open-minded to finding out more about the person's interests, challenges, and goals.
Mm-hmm. Yeah, and so one of those trends that we were talking about earlier too is that a lot of aging adults are at a higher risk of health co-occurring conditions. So, epilepsy, depression, mental health concerns, allergies, cerebral palsy, diabetes, Parkinson's disease, ADHD. And then some traits or habits can also pose health risks and can compound over time. So for example, if there's an unusual food preference, or there's a certain texture in the food that someone is unable to eat or process, and that just might be specific to an individual. And so there can be side effects where it's, poor diet or maybe poor sleep or sleep apnea. And then another trend that we've noticed too is that there's a lot of stressors that can be experienced. So stress does raise the risk of heart disease, strokes, sometimes even can impound or impact mental health, co-occurring conditions. It can also lead to burnout. So what we're seeing is that the world generally can appear unfriendly. We're not saying this is the same for everyone, but it can appear unfriendly or unfamiliar. And individuals who may attempt to mask their diagnosis, that can add another layer of stress and can lead to increase of energy consumption. So all these things we see over time with the community or with our community. And so what we'd like to do is see ways in which we can support that once again. So kind of moving to, once again, there is support and there's options available. One thing that can help, especially when we're talking about dietary needs, is we can have individuals come in and help with meal preparation, building those skills for meal preparation, helping with exercise or walks around the block, and even monitoring of health conditions. So that nursing support for individuals who may need that extra little something. It's specific to everyone, so it's different for everyone too, right? So whether it's support around mental health specifically, or maybe the goal is support for independence. In addition, all of our caregivers, all of the individuals we have on staff, they're trained with dementia care. So when we're talking about that cross-sectionality of individuals as they age and some conditions that we see that may be more prevalent, that's something that we ensure is there. So in addition to training our caregivers to work with autistic individuals, we're also training them on palliative care and dementia care. Should I go to the next slide? Okay. So themes in care. One thing that we loved in terms of a quote is, we don't get to participate in the things that will often get the rest of us out of the house and keep us healthier emotionally and physically. And that's a quote from Christopher Hanks, Medical Director of the Center for Autism Services. And so one thing that we can see, once again, another trend, is that social isolation can have a compounding effect on an individual's health. So as we age, our social interactions are really important for alleviating stress and helping maintain a support network. So while some families or some individuals may have support networks, those support networks can really change as we age. So we may find that, once again, there's inconsistent caregivers, or maybe our supports have changed as we've grown older. And so some families feel the only option is, once again, to go into housing, but there are alternative options where we can start to build that support network earlier on, maybe having someone who is a trusted staff or caregiver come in. And so that way we can start to build those social touch points. Other trends that we see is self-isolation, loneliness, so a sense of rejection, less access to counseling, and underemployment or a lack of social opportunities. So once again, there's support. We just want to emphasize that. So there's different options that are available. One thing that we do with Bayshore Home Health is we offer respite and companionship. So we can help provide supports to individuals in their homes and their communities, and also help with basic self-care. Oh, okay. I thought maybe you wanted to share something. So essentially, there's different ways that we can address social isolation. I don't think there's ever one straightforward path to it. So if there is a goal of going outside, or maybe learning on how to access different supports, so once again, you can remain in home, maybe we can have someone either do walks, help with exercise in the community, help with that basic self-care. So our focus is really on maintaining that health, whether it's mental or physical, so someone can stay in their home and so they can stay in a place that's familiar with them as they age. And I think that's really the perspective that we take as a company, because we've seen that, generally speaking, it has positive impacts or positive externalities, as we like to say, on an individual as they age. or as we age. So executive function, that's another trend that we have, and that's difficulty with organizational, planning and home care skills, and accessing care can also be a really difficult task. So when we say that there may be a general concern over organizational planning and home care skills, which may mean missing out on preventative care, which we did mention earlier, so missing those medical appointments or having a hard time with medical appointments. And it does take a skill to realize that an appointment is needed and to remember the schedule and to keep to it. Or even sometimes filling out forms. Forms can be daunting and they can be really confusing. For some reason, we all like to make very convoluted forms for people to fill out. And so from our perspective, that's another thing that we can help out with. So as a company, there's services where we can have our caregivers help ensure bills are paid, prescriptions are filled, to make it to appointments, and even to help with enrollment in government assistance programs. Public assistance systems, once again, they can be very confusing. It can be a challenge to get to a doctor's appointment. It can be a challenge, especially with a lack of a support network for a person to maintain their autonomy. So ideally, we just don't want to be forced into a facility or housing situation that's not ideal. We want to have choice. And so this is all about presenting different choices and looking at it from different perspectives, right? When you don't have a choice, that can once again lead to trauma. It can lead to different behaviors and even adverse mental health conditions. So at the end of the day, we do have different levels of care. We have everyday care, we have essential care, and we have enriched care. So 3 different categories is how we can kind of break it out. So the everyday care is stuff like companionship, going out into the community, going to appointments, reminders to do tasks, running errands, picking up prescriptions, grocery shopping, meal prep, light housekeeping, so any of that cleaning, even building up the skills to do the cleaning so someone can learn to be independent. There's also the second tier, which is the essential care. So that's personal care, bathing support, mobility assistance, those kinds of hands-on off tasks. And the last one is that enriched care, so those medical tasks. So we're talking about medication, injections, wound care, things that really should be helped for by nurses or by personal care workers who are registered and licensed. Now, I'm not sure if I'm missing anything, but I was just going to go to our last slide and then open it up to some of the questions that we may have received.
Yeah, thank you so much for being able to go through those different services that Bayshore offers. I know that with like an aging autism community that would feel way more comfortable staying in their home or in a place that they feel comfortable with, it's good to be able to go through some of the other options that are available. One of the questions that came through was, this is a fee for service, and would you be able to share like a pricing guide, or how would people be able to know what different levels of support cost?
Mm-hmm. Yeah, so there's different approaches. Sometimes you can get it funded by the government. So as a company, there are government supports such as CLBC if you are one of the individuals who qualify under the CLBC stream. So we're one of the qualified agencies that work with the government. If that's not something that's possible for yourself as an individual or as a family looking for supports for an individual, then we do have the private tier, which is paid directly by an individual or even through insurance. And we can help you navigate insurance. If you do have a provider, we can do that on your behalf because that can be quite hard to do. So a lot of insurance companies may actually have insurance already built in for extended health. So it's always good to explore that because you may have an amount that's provided to you that's already in place that you're not aware of for either nursing or housekeeping services. As far as our private pay, it's different per branch. In the province of BC, I think we're mostly all in the same amount for our branches. So when we talk about the different tiers, when you're looking at companionship, or the tier 1 that we're talking about, so the meal preparation, the housekeeping, our prices right now for the North Shore, and I believe also the same for the Richmond branch and Surrey branch, is $34 an hour. If you're looking at more of the medical support by a licensed individual, so when we're talking about dressing or, pericare, or I'm just trying to think of the different ones, lifts and transfers, or stuff that may need a little bit more technical support, that's when we look at $38 an hour. And then if you're really in need of high medical support, so, trach and vent, wound care, that's when we need to have a licensed nurse go in, and that's a higher cost. So depending if it's a licensed practical nurse or if it's a registered nurse, there's 2 different costs associated with that.
Okay, nice. Thank you. That's very helpful. We had a question that came in, and sometimes people aren't the right fit or the perfect fit for individuals. Is there any say in who is part of your support team? And if someone is working with you, are you able to change that?
For sure. Yeah, we really, with any of our clients, we definitely look for a good fit, and we're in communication with the team, the home team and Bayshore, to find the right fit. And we're absolutely open to feedback. And we also can just add in more training or more shadow visits so that somebody becomes more familiar with what needs to be done. We don't give up easily. We think that we can find solutions and find the right fit for support in each family.
And do you have other ways that Bayshore is showing itself as an ally to the autism community in your team or in the work that you are doing?
Absolutely. So not only are we trying to become involved with the community, but we're also building capacity internally. So when we say that, is we're making sure that all senior management and management is fully trained on how to support autistic individuals, and all of our field staff. Not only that, but we're looking at ways that we can increase our diversity and inclusion internally as a company. So that takes a bit of time, but we're working on our pipeline process in terms of anyone who might be interested in applying or being part of the Bayshore team.
Do you have any current openings? That's always a question that we have is, do you have an inclusive hiring practices? How can people apply? Are you looking for more people to work?
Absolutely. We're always looking to hire. Each region has their own recruiter. So if you can either look, there's postings everywhere, really. You can find us pretty much everywhere, or you can connect with us directly. The roles that we most commonly hire for are our home support workers and our personal care support workers. Now, once again, if you're a personal care support worker, there is a requirement for a certain certification program that those workers have to go through, because they have to be licensed individuals or certified individuals. That's the word that I'm looking for. And so we'd be looking for that certification. And we're happy to help for the home support workers. There's not necessarily a certification for that one for anyone that would be doing meal preparation or housekeeping. So if anyone's interested, they're more than welcome to reach out to us, and we can put them in touch to the right recruiter and start that conversation or that dialogue.
Nice, thank you. We had one more question about regions, and you mentioned that there are different regions. I know that Bayshore is national. Do the levels of care and the levels of support, do you have all 3 of those levels of care in all of the different regions across British Columbia?
Yeah, for the most part, yes, I would say, and I can outline, we've got branches in BC, on Vancouver Island, focused out of Victoria, Interior focused out of Kelowna, and then the Lower Mainland. We've got the North Shore, Vancouver as 2 different branches, one other branch is Surrey, Langley, out to Chilliwack and Abbotsford, and then White Rock, Delta, and Richmond.
Okay, that's great. Those are all of the questions that we had that came up right now. I find a lot of the time when we do these live presentations, people will email or send our hello at Autism BC questions afterwards, because they'll be able to get home or find a different time to be able to connect and get this information. But I really want to thank you for taking the time to be able to connect with the Autism BC members today and be able to share the services that you're able to offer to better support the autism community.
Absolutely. Thank you for having us.
Thanks.
And once again, if there's any questions about any of the services or details, people are welcome to always reach out. We're always happy to have that conversation or free consultation if that's what's needed. Yeah.
Okay, and I can link in the contact information into the side of the video here and be able to share with people.
Absolutely.
So
Yeah.
Okay. Well, thank you. Thank you for viewing. And bye for now.
Thank you. Bye.